Since 2008, Care Kenya and Procter & Gamble have been transforming access to safe drinking water. What began as emergency water purification supplies has grown into sustainable solutions, building water systems, improving governance, and empowering women and youth across Migori, Kisumu, Siaya, and Busia counties. Before this, many households boiled murky water just to survive. Today, change is visible. A student returns home from school and gently teaches her caregiver how to use water purification supplies, turning a daily struggle into safe, healthy living for families.
We've been working with the Care Kenya since 2019. They have been supporting Rodi Health Center and Langikawino Dispensary.
So they have been supporting us in a number of activities. One, in provision of water purifiers and other water treatment services. Two, they have also capacity built our CHPs and CHAS on water purification methods.
Meet an 18-year-old girl living with sickle cell anemia. Her life depends on staying healthy and staying hydrated.
Aya e sub-location market ni kae. An gi nyithindo abich. Moli ema nigi tuo mar sickle cell. Koro en ema nigi tuo to kaluwore kaka nochako tuo, nok ang'eyo ni en tuo mar sickle cell nikech nok ang'eye. Ka adhi osiptal, inyisa ni mondo achaka transfer Russia. Koro ing'e ni kanyo ema nafwenye ni en tuo mar sickle cell. Koro wa kanyo osechanda kabisa kaluwore gi tuoneno nyaka sikul. Koro sikul no be odhiga kadichiel ma ok odhi seche te, ma sani kaluwore gi pi matiyo godo gi yath ema kelo ma mondo mi koro tuoneno odog piny.
Asomo skul mar Kajuni, iluongo ni Kajuni. An ja form 2. Pi amodhoga gokinyi amodho glass achiel. Sa 7 amodhoga glass 2. Gotieno amodhoga glass achiel. Ka mama onge to anyalo thiedho. Pi mothiedhi aseneno kaber ahinya moloyo pi mok othiedhi.
Nyaka ne Care Kenya puonja kaka an John kama asebedo gi knowledge ma tinde kata kawuotho kata kadhi wendo kamoro kata nyaka ne to pi ma ji dwa modho kata mana liende bende en pi mothiedhi koso en pi manotuom to kolose.
Since her family began using PUR-treated water, she's experienced fewer infections, fewer hospital visits, and more days feeling strong. For her, clean water is not just a need, it's a lifeline. In facilities like Manywanda, inline chlorination now treats water at source. Clean water supports patients, staff, and nearby homes, restoring trust in healthcare.
My name is Mwanzia Kioko. I'm a project officer at Care International in Kenya. We have this program for passive inline chlorination that is currently going on at Manywanda Sub-County Hospital. So basically, Care has partnered with the University of California, Berkeley in the US to pilot that device that chlorinates water automatically. The facility has immensely benefited from this program because one of the things that we've discovered is that during the water collection, there's no need to actually treat manually, but the water is already automatically treated and placed, and it's collected and placed at designated areas within the facility.
Because the same way we treat water in the facility, that is with us we use chlorinated through the Venturi itself. It's the same way clans are also treating water in the community by the use of pur. Because even pur, if they treat water using pur, it's more safer to them other than drinking, just taking the water the way it is. Yeah, so it has been a good change to us, and we currently don't have a lot of admission with the clients with the waterborne diseases. Majorly with the few cases which we just give oral medication and they go back take at home. But for the admission is very few. Yeah.
Hii Venturi ilianza kutusaidia. Tena tumeona kazi yake ni rahisi kuliko pur. Hata community yetu imefurahia. Kuna community wanakuja wanachota, wanatumia. Kwanza ni rahisi kutumia, manake maji yanakuwa treated hapo kwa hapo. Unachukua unaenda tumia.
Initially we had been using pur. So we had to use the water from a river watch. So we purified it using pur. So at the moment, I am using Turitap. So the problem with the water from our watch, it was not easy. It need a lot of time for it to be purified. Then for this Turitap, you just put chlorine and it is just like that.
At water ATMs, women and men collect water digitally monitored and locally managed. Clean water is now closer, safer, and more reliable than ever. County governments stepped up, adopting policies, reviewing tariffs, and investing in water systems that work. Water is now planned, protected, and prioritized.
Korono konyo pi gi jo Kenya ma negina jok ma kunyo pi ma konyo nyithindo iluongo ni children safety drinking water. Koro kane gibiro gikunyo pi, pigni osekonyowa kabisa. Ne gikelonwa water ATM ma giketonwa from Maji Milele.
Jo Kenya oseterowa trainings mopogore kochakore gi Kisumu ma wadhie mogik no wadhie sori kamoro ni Hippo Point ka gipuonjowa kaka pigni en. Koro aseneno ber mar pigni nyaka sani.
We've had capacity building sessions that involve the community members, the management committees, the county staff, the chiefs. So in that way, all these people are involved, and so they are able to coordinate how these projects are managed. And if there are any issues arising, then there's seamless working out of whatever issues there are to solve them so that the problems are not escalated and affect the projects.
We've been going for several training, and we've been encouraged to ensure that all children and all learners are provided with P&G to use at school and at home.
Since we began our partnership with Care Kenya, I think before they came on board, we had a lot of diarrheal cases. But with Care Kenya coming on board, at least the diarrheal cases have greatly reduced. In a scale of 10, we can put it to 2. Through the knowledge that some of us gained during the meetings, we've always put them into practice. Like for the, setting up of gutters and what you can do, the amount of water you can maybe fetch from different angles. I'm
the medical superintendent of Madiani Sub-County Hospital. Madiani is situated in Rarieda Sub-County within Siaya County. So we were able to get 2 tanks from Care Kenya, which we are highly appreciative of, each of 10,000 liters. The tanks currently are fully functional, and so far I can say the partnership has brought a huge relief, considering it has helped us improve the sanitation in the facility because now we have more water available.
My facility experience with Care Kenya has been so good. Care Kenya came in, we had rain catchment system installed earlier when the facility was built, but due to lack of renovation for quite some time, it was dilapidated and it wasn't working so well. So Care Kenya came in and they renovated. So currently we are able to use our water catchment area very well, and at least now as a facility in all of the working stations, that is the nursing area, the MCH, OPD and even the lab, we now have running water, courtesy of Care Kenya.
I just want to register my appreciation to Care International in Kenya. They have helped us done much. They have helped us reach the areas which we were not able to reach. To the most rural areas, they have helped us to reach those people. So I appreciate them so much, all their effort. We appreciate whatever they have done to us.
Along the lake, beach management units are leading the charge, training fishers, cleaning shorelines, and distributing water purification supplies.
Fort Victoria Station mans two sub-counties, that is Siaya sub-county and Bunyala sub-county. In these sub-counties we have 20 BMU in total, and in the 20 BMU we have worked very closely with Care Kenya, with the BMUs within Bunyala sub-county, that is 15 beaches, in matters to do with capacity building of this BMU on water quality. We have done about fish handling. We have also done capacity building on the safety of water for drinking and even the washing of hands.
Tumetembelewa na wageni wetu kutoka Kenya Care ambao kwa muda ambao wametutrain kuhusu mambo ya maji na afya kwa jumla.
Nawashukuru sana kwa maana wametusaidia sana. Jinsi mnavyoona, hii ndio maji ambayo tunatumia na iko exposed sana kwa kila aina ya uchafu. With Care Kenya imetusaidia sana kupata dawa ya kutumia kutreat hiyo maji, and in partnership with the Marenga Omena Beach tumekuwa tukifanyia karibu sana. Wametusaidia sana katika household levels, wametusaidia ku-educate, kupeana mafunzo jinsi ya ku-maintain hygiene, sanitation. Ni kitu tumekuwa pamoja nao sana, wametusaidia sana.
Across the counties, leadership is changing because inclusion leads to impact. In schools, health club students are trained on how to use water purification supplies and pass the knowledge to their peers.
I'm the head of institution, St. Cecilia Girls School, primary and junior, from Siaya County, Bunyala sub-county. Care Kenya has made a very big impact in my school. First of all, they served us with containers for water for drinking and washing hands, even before COVID. So we have been moving together. After that, they gave us a tank to harvest water, and it has really made us to retain children in school. And at the same time, they provide us with pool to treat that water. So it has limited, almost stopping the infection of these waterborne diseases that were very rampant in the school. The sickness that used to attack them more, the learners are always in school because the sicknesses have gone down. And also, it has helped us to improve on sanitation.
I appreciate their work. They have already given us some care containers which are being used for clean water. Our girls, because of the training which we've got from them, we have already trained the girls how to clean this water, how to keep it.
Thank you so much, Care Kenya. Irukamano. Asante sana, Care Kenya.
Thank you so much. Asante sana, Care Kenya.